Okay, so this is going to cover gastric motility, and it's going to cover all of the different types of laxatives. Okay, so for gastric motility, this begins in chapter 51. When we're speaking about gastric motility, we're talking about peristalsis. Okay, that's undulating movement of the intestinal tract. Okay, it moves contents through the system. So we've talked about what peristalsis is already. If a patient has increased motility, that's equivalent to diarrhea, right? We have too much motility going on in that intestinal tract, so the patient has diarrhea. If there's a decrease in motility, that is basically saying that the patient is constipated. So we have slow peristalsis, the patient's going to become constipated. Okay, so now we're going to go over all the different types of laxatives. So generally speaking, when we're talking about laxatives, the therapeutic effect is that we soften the stool, we increase stool formation, and then we decrease the straining that occurs when having a bowel movement. So for indications would be if your patient was constipated or straining to have a bowel movement. With that, you want to remember, so important to remember for that is used to decrease constipation and straining. That's why we give laxatives, okay? We want to avoid, it says avoid Valsalva. What that is we're gonna avoid vasovagaling the patient. And what does that mean? So we have something called the vagus nerve, and that's a cranial nerve that connects the brain to the body, okay? But it stimulates certain muscles in the heart that help to slow the heart rate. So if we stimulate that vagus nerve, what happens? We have a decrease in blood pressure and decrease in heart rate. So the patient who is actually straining to use the bathroom, so you might hear of this, especially if you work in an ER, but you might hear of this frequently, or had a family member this has happened to, right? Maybe grandma or grandpa was trying to use the bathroom, and then all of a sudden they passed out, and now they're in an ambulance on the way to the hospital to get a CT of their head. Well, what happened is that they were straining to use the bathroom, probably because they were constipated. They stimulated that vagus nerve, and it caused a drop in the blood pressure and heart rate suddenly, again, due to that stimulation of that vagus nerve. And the result is the patient can faint. So we want to avoid doing that. Precautions and side effects, fluid volume status. So remember, if we're giving a patient a laxative, right, something to help them eliminate and go to the bathroom, could we overkill on that, right? Could they take too much and then they have a lot of elimination, a lot of fluid and electrolyte loss through their feces? Yes, they can. So those are things that we need to be careful about and monitor a patient for. So fluid volume status, medications, primary medical history, we want to know if they've had any history of other GI disorders. If the patient's had surgery, again, fluid loss or that loss of volume is going to cause hypotension. Nursing actions, assessment of therapeutic and side effects, and then the appropriateness of the agent. Okay, so now we're going to get into the different types of laxatives, okay? So bulk forming is our first one. Mechanism of action, water retaining cellulose derivative. This is the bulk forming laxative, and that can either be natural or synthetic. So the whole point of this is that it increases water absorption into the intestines, right? It draws the water there. And then we have an increase in bulk or total volume, and it softens the stool. Okay, increases water absorption into the intestines, increases bulk, total volume, and softens the stool. So side and adverse effects, it really depends on what route we're giving the medication. So you see here esophageal obstruction or fecal impaction. So what can happen is if we're giving the medication orally, so you see here the drug example. The drug example is Psyllium. Psyllium, the trade name is Metamucil. So you've probably seen Metamucil commercials before. I don't know if maybe you've ever had it or had a family member that's had it, but it's basically a powder. You add water to, you mix it up, and then you notice it's going to start to thicken, okay? So if we give that to the patient and then they swallow it, maybe they're taking too long to drink it, either way, some of that drug can get in that esophagus and basically bulk in the esophagus, and then the patient has an obstruction there, okay? We can also cause a fecal impaction as well. And that drug example again is Psyllium, and the trade is Metamucil, but Psyllium is the only prototype generic name that you will need to know. Okay, so for emollient surfactant, mechanism of action, this is a softener. Okay, it increases water and fat in the intestines and helps to lubricate the feces. This will help the patient evacuate easier. So the side and adverse effects would be abdominal cramping and diarrhea. And then the drug examples, which may look familiar to you, possibly, is docusate sodium. Docusate sodium is the generic prototype name you'll need to know. The trade name is Colace. Colace is what you've probably seen on the store shelves. You're going to see this a lot if you are ever work in or help out in a long-term care facility, or you'll see it also in the acute care setting on the med-surg floor. A lot of patients end up taking docusate sodium for a few reasons. Somehow, or for whatever reason, they have decreased peristalsis, right? It could be due to lack of activity, right? Because we know activity helps increase peristalsis. It could be a combination of the medications that they're taking. So you see this kind of frequently in those settings. And then stimulant. So stimulant mechanism of action, it does exactly that. It stimulates the nerves leading to the intestines, which helps to increase peristalsis. And then our side or adverse effects could be abdominal cramping, and also the patient can develop a possible dependence. So the body's going to end up relying upon the drug to stimulate a bowel movement. This is huge, especially for our elderly population. Our elderly population are fixated on having bowel movements, fixated on it. If they don't have their daily bowel movement, they're not happy. Well, the problem with that is as we age, and as we've talked about, peristalsis slows down, right? Their activity has also slowed down. Not only that, they're not eating as much. They've lost their thirst drive and they don't eat as much food. So if we're not eating, we're not pooping, right? We're not having those bowel movements. If we don't have activity like we should, peristalsis again slows. Normal aging process, peristalsis slows. So it could be very normal, especially for the elderly patient, to only have a bowel movement once every few days, but they're fixated on the fact that they should be having one daily because that's probably, as a younger person, that's how it was for them. So they get to taking some type of stimulant or laxative every day, and now they no longer can have a bowel movement because their body has now relied upon the drug to stimulate a bowel movement. So it's really important that this is a really easy class of drug for elderly patients to abuse, or anybody for that matter. So again, we talked about the side and adverse effects, and then the generic prototype name you're going to want to remember for that is bisocotyl. Okay, so now we're on saline. Mechanism of action, it increases osmotic pressure in the small intestines, so it's going to increase water into the stool. Side and adverse effects is nausea, vomiting, abdominal pain, electrolyte imbalance, and it's contraindicated with renal disease. Example, so the prototype you would need to know for that is the magnesium hydroxide or milk of magnesia. You've probably heard that name before. Hyperosmotic. So when we're saying a hyperosmotic, that is a higher concentration of solute. So the mechanism of action is going to increase water content in the large intestine and peristalsis. Side adverse effect is nausea, vomiting, and hypovolemia, because this is a little more concentrated, a little more stronger, you could think of it as. And so we're really going to stimulate a bowel movement here. So it's very possible that we overstimulate, right? And the patient has diarrhea, or they have a lot of fluid and electrolyte loss through their feces. So drug examples, you have to know these, okay? These are your starred prototypes, and we'll talk about each of them. So you want to remember all of the little tidbits I provide you for these. So lactulose, okay? So lactulose, we do use that as a laxative, okay? But it's also used to treat ammonia levels due to liver failure. Ammonia is a byproduct of protein metabolism, which is converted into urea. So if our kidneys are having issues as well, we might not be able to excrete and eliminate the way we should. So what we do is we give the patient lactulose. It helps bind to the ammonia, and then the patient is able to excrete it through their stool. So if you saw a patient on lactulose, your first thought should be, okay, well, are they constipated? If they're not constipated, your second thought should be, is they're probably on this because of liver failure. Let me go check their ammonia level. Their ammonia level is probably elevated. So that's where your thought process should be with lactulose, okay? Go lightly, or polyethylene glycol. Polyethylene glycol is the generic prototype name you would need to know. Go lightly is the trade. This is actually used as a bowel prep or bowel cleansing prior to surgery, or prior to, any type of maybe GI scoping. So if they're going to have any type of procedure as such, they're going to have to drink this polyethylene glycol. It's miserable. It's literally like a huge plastic gallon It's full of powder, and we set it on the patient's table. We fill it with water. We shake it up. They have to drink like the entire thing. It's the most miserable thing ever. So typically I give them a cup with ice and a straw so they can just pour it over ice and then just down it as quick as they can, because it's not a fun experience. Sorbitol. Sorbitol, you'll also remember, is also a sweetener, but it also helps with elimination or stimulating that bowel movement.